Hello, everybody, and welcome to a spring breakfast or Longwoods breakfast. It's the first spring one we've had, so it's nice to get off to a good start, although it's rainy here in Southern Ontario. Happy to have so many familiar faces online with us this morning, as well as a number of new people. For those of you that are new to breakfast, I am your host, Matthew Hart, CEO for Longwoods. As you know, I'm looking forward to today's discussion. I have worked and known with, I've known and worked with a lot of people from Philips over the last many years, and today promises to be an engaging discussion. Also, a quick reminder, for any questions that you may have, please don't use the chat function, use the Q&A function. That's where they'll be monitoring the questions. Before we get started, I did want to remind everybody that myself and Longwoods are strong believers in building your network. To that, I am happy to encourage everybody and to reach out and connect with me on LinkedIn, share your stories, share your thoughts, share your opinions. You will also find both Darren and Shez on LinkedIn and other social media platforms, so please feel free to connect with them as well. So let's get started. To lead us through our conversation and welcome our featured speaker today, I would like to welcome the just newly announced Managing Director for Philips Canada, Darren Fisher. Darren, it's all yours.
Wonderful. Good morning, and thank you, Matt. I appreciate the warm welcome, and thank you for allowing Philips to host the session today. Good morning to everybody on the line, and thank you for joining. As the Philips Canada Managing Director, I'm really excited to have Dr. Shez Partovi join us here today in Canada. And although Shez resides in Europe and is part of the Philips Global Leadership Team, he's certainly a fellow Canadian at heart. He obtained his medical degree from McGill University and completed his neuroradiology subspecialty at Barrow Neurological Institute in Phoenix, Arizona. Shez is a serial entrepreneur and has launched several IT companies, including 2 telehealth companies. And after a decade of clinical practice, Shez transitioned into executive roles at Dignity Health, where he served as Chief Health Information Officer and Chief Digital Officer. He oversaw the deployment of electronic health records and PACS systems across the enterprise. And he was also responsible for the digital experience of consumers, patients, and providers across Dignity Health. Subsequently, Shez joined Amazon Web Services, where he was the head of worldwide go-to-market strategy for healthcare, life sciences, and genomics. And today, Shez is our Philips Chief Innovation and Strategy Officer, where he brings his clinical, entrepreneurial, and cloud experience to accelerate the Philips transformation and innovation journey. And Shez's career really has been driven by the belief in using technology for humanity's benefit and a passion for impact at scale, which you'll hear about today. And by leading meaningful innovation at Philips, he plays a critical role in our purpose to improve the lives of 2.5 billion people by the year 2030, including 400 million people in underserved communities. So without further ado, I'd like to welcome Shez to get the session started.
Thanks so much, Darren, and thanks, Matt, as well, and Longwoods Publishing, and delight to connect with fellow Canadians. I'm going to go ahead and share a screen here, and then we'll go from there. All right. Before we start, yes, it's just such a pleasure to connect with fellow Canadians. As a beneficiary of the Canadian generosity as an immigrant, I'm always eager to connect and find a way to give back to Canada. And so whenever there's an opportunity to present to folks that are actually working in healthcare in Canada, I always have a particular interest to see if there are individuals with whom we can partner to do something great in Canada. So please consider that as you listen to the stories that we talk about today, that I talk about, and the discussion we had. So really, thank you so much for coming. And today we're going to talk about connected patient-centric care and enabling that across the continuum. And of course, everywhere you look, there is data that says the pandemic has accelerated digital transformation. I don't need to tell you this, it's like being Captain Obvious. But there are great publications out there that actually validate this, whether it's from Accenture and the Digital Health Technology Vision 2021 that talks about the executives that are leaning in to health transformation, 81%, or whether it's from Deloitte, talking about CFOs spending up to 80% more on digital transformation, or Philips itself, the Future Health Index that we did, talking about the increased expectation of adoption of telehealth. Today, really what I want to do is talk about the signals that I have personally been hearing, Philips has been hearing from customers, over the course of recent months and past 2 years, and then dive a little bit into those and talk about the things that we're doing at Philips to help advance solving those problems for customers. And I would say that the signals that we get, and I've gotten personally from customers, really fall into these three categories. This idea of how do we enable remote access to clinicians? Because of course, not only was this a subject before, but it got accelerated because of the distance that was mandatory between a clinician and a patient, whether in the hospital or outside of hospital. So we'll touch on a few things there, talk about TeleICU, about real-time collaboration and remote access technicians as workforce becomes an issue and access to workforce. I'll then talk of just to give an example or two from this push for arriving at actionable insights. We'll actually talk about what does that really mean and give an example or two of that as well. And then we'll go ahead and talk about this desire for engaging patients remotely, whether it's video visits, online scheduling, which if anyone any doubts for online scheduling for vaccination became really the rallying cry for the mass introduction of online scheduling, which is appropriate. And we'll talk a bit about biosensors and how to actually do remote patient monitoring using wearables. So let's go ahead and turn our attention to the first category here and talk about remote access to clinicians, what we've been hearing and what we've been doing to help solve this problem. Let's begin with TeleICU. Now, for those who may or may not be familiar, the idea of TeleICU is that you're basically putting equipment, both audiovisual equipment, but also computing integration equipment into an ICU. So a hub and spoke model where you have a rural area, maybe in an underserved community, maybe just across town because they don't have intensivists. You put the equipment in that unit. And then in another location, in sort of a hub area where there might be a center of excellence or just staff available, they are providing remote monitoring of patients, sometimes in tandem with local physicians that may not be intensivists, sometimes they may be intensivists, and sometimes with extenders that might be in the field. And so this is an area that Philips has had a long heritage of excellence, over 15 years, plenty of experience, and really helping shape and lead the industry and being able to deliver, help clinicians deliver remote care at a distance in an intensive care setting. And in case you're wondering if it can scale, I mean, a good example would be, for example, in the United States, Northwell Health in New York, where one of the facilities, their academic medical center, North Shore, the North Shore University Hospital, that is actually managing 350 ICU beds in the broader sort of a metropolitan New York area from that one center. And during the pandemic, actually wanted to set up an additional spoke. And within 48 hours, we helped them get that particular site in Lenox Hill set up. So from a scale point of view, this provides incredible scalability to be able to move electrons instead of atoms. Instead of moving the atoms of an expert from one site to another, you're moving their electrons and delivering care remotely, enabling that. So that's sort of intensive care. Let's actually, you know what, before I go forward, let me tell you about outcomes. Let me go back one slide because we say, well, so what? What are the outcomes? A great example of an outcome would be actually from one of the facilities in the UK, Gwendon Hospital. Reduction of serious events by 35%. There was decrease in mortality in the ICU of the remotely monitored by 40%. There was an actual amazing reduction of cardiac arrest events by 80%. So this early warning system actually helps deliver higher quality care. In another one, in one of the hospitals here in the Netherlands, there was a 24% reduction of readmission to ICU for those ICUs that were monitored, and a 20% reduction of readmission to the hospital in general for those patients that had traversed through a remotely monitored EIC room. And then that's from a care point of view. From a cost point of view, I'll give you an example from the US, and that was Emory Health. Over the course of 15 months, showed that the cost of care in the intensive care unit went down by about $4.6 million US because of the ability of early surveillance system. Because it's not just video monitoring. This is using AI and machine learning to predict an event and to alert before it happens. So that's why you can have these better outcomes, because you're actually getting ahead of it. Let's shift gears and talk about another area that really accelerated during the pandemic, and it actually is really interesting and valuable, which is there are areas of the world where, by the way, it could be areas of the country where you want to have access to diagnostic equipment like ultrasound, but you may not have the radiologist to be able to actually do it because some of these technologies are actually require extensive training to use. And one of the technologies that Philips has is the ability to actually look over the shoulder of someone who's doing a procedure remotely, like in the case of ultrasound, for example, and it could be anywhere in the world. A good example is there are physicians in the US and in Europe that are helping residents in Rwanda at Kigali University, where they're using this technology as a combination of Lumify and a technology called Reax from Philips that allows this sort of a over-the-shoulder video real-time support of another clinician that's actually delivering, doing the ultrasound. And if you've done ultrasound, it's quite a bit of training to actually do it. So this enables to, again, move the electrons of the expert rather than moving the atoms and provide that point of care support in whether it's underserved communities or whether it's just remote areas within US or Canada. It doesn't really matter, this ability to provide that expertise. So that's another area where Philips has been doing quite a bit of work in acceleration because of the need that came forward to us from communities and clinical communities throughout the world. There's another really interesting example of this, which is packaged from just being the remote ultrasound supporting resident to being actually a solution that's sort of mobile. It's called mobile obstetrical monitoring, or MOM for short, where care extenders anywhere in the world can partner with an OB to actually go into communities and do antenatal care, do early screening, and to be able to deliver care where the mom is, no matter so if she might not be able to travel distances to a center of excellence. And in different parts of the world, this showed incredible value. There was a study done in Indonesia, actually, where this was being used in mom, and they were able to identify high-risk pregnancies at 3 times the normal rate of the sort of traditional methods. And in that study, over the course of a year, there was a 99% elimination of anemia in the mothers. And of the mothers that were in that program, 89% went to full term. If you're familiar with the statistics, these are actually incredible progresses for these communities. So this idea of being able to, again, extend technology, use technology to extend expertise is an area we saw a lot of need, and we have been working to advance it. And then finally, I talked about workforce. One of the areas of workforce need is actually to be able to support other imaging centers. So if you have MRI centers or CT scan centers that may not be in urban areas, sometimes the ability to actually provide services is limited by the expertise, the technologists. And so we have a solution called Radiology Operations Command Center that's actually vendor agnostic. It doesn't have to be Philips equipment. It helps a technician, an expert technician in a sort of a command center mode to extend out and help other technicians that are doing scanning to be able to do the right protocoling, the right kind of imaging, verify the imaging was done right, and to see if it was optimized to avoid recalls, to avoid inadvertently incorrect scan type, or if they gave contrast, didn't give contrast. So this is another example of, again, moving electrons instead of atoms, remote access to expertise, whether it's a technician, whether it's a nurse, clinician, a physician. And so this is an area that we saw incredible growth and demand, and one which we rose up to meet that challenge with some of the solutions that we've had for years in the market, like TeleICU, and some of the solutions that we've developed in order to help our customers and help organizations meet the challenge and going ahead. Let's shift gears and talk about actionable insights and some of the things we're seeing in the needs in the market around this and what we're doing to support it. So operational forecasting is an area of, it exploded during the pandemic everywhere in the world. Now, let me give you an example of operational forecasting. I remember I was talking with this chief operating officer, and this is last year, and she said to me, look, Shez, I don't need to know what's happening in my hospital right now. I need to know what's going to happen in my hospital next week. And to her, what she was telling me is that, look, we've gone from, and I remember we're looking at Excel files of operations that were like a quarter, a month old. That's way gone. We as an industry moved to sort of real-time visualization, terrific. But what the industry and what customers are telling us is, I need to be able to see into the future. It's not enough for you to give me fancy visualization of my data right now. I need you to be able to, and in fact, you and I, we use this all the time. If I told you that I can give you all of the weather data for Toronto on your iPhone, you're like, okay, well, that's interesting. I just need to know if I should have an umbrella icon or a sunshine icon, if I will, because you just want to know, do you take an umbrella or don't want to take an umbrella? You want a forecast. All the weather data of Toronto on your phone is of limited value. You're not going to sift through it all to figure out what's going on. You want to know in the middle of the day, when I'm out about, do I need an umbrella or not? Maybe not in Toronto. I guess you need, it's either going to snow or have sunshine. Maybe if it was in Vancouver, where I used to live, you'd want to know if you have an umbrella or not. And so this idea of forecasting is critical, and we heard from customers as well. So one of the examples of what we've developed is this being able to forecast patient flow. And by that, I mean this idea that you can predict things like, okay, the patient just got admitted. Based on the app, and the models, by the way, the machine learning models that are built are based on the organization's own data, because that's really important. If you're going to build machine learning models, you're not going to try to take a model from UCLA and try to apply it to UT. The idea is we work with our customers to take the actual data, a priori data, and then build a model that's local to the organization, because healthcare is local. Diseases are local, trends are local, everything is local. So these models are fine-tuned with local data. And then so when a patient is admitted, you can, based on the data that's been used to model for that particular organization, you can predict things like length of stay. Now, how would, when I think of care management, when I was working in a hospital, care management used to come in and they used to go through the hospital either alphabetically or by floor to look at care management and see if the patient can move to the next level of care, if they can be discharged. How would you do care management different if you would come in and it's sorted by length of stay? If your average length of stay is 3.3 days and a patient comes in and the machine learning model predicts the length of stay is going to be 6.2, well, you might want to go and see what is going on, and care management teams, they may be called something different in your organization, might be wanting to look at it based on that. So this idea of predicting duration to transition of care is one in which is this idea of forecasting your patient flow from the moment they come in the hospital, as they go from transition from level to level, you can predict, and including predicting the likelihood of readmission and so on. And so that's an example, and this particular solution does it at admission, does it at 24 hours, 48 hours, and 72 hours using models that are built in based on local data to be able to predict the particular journey for this individual. And the model gets refined because, of course, you're using it in real time, and the model is self-learning. And it's actually constantly improving itself. So this is an example of operational forecasting that helps an organization basically run itself better. What is my emergency department going to look like next Thursday at 8 p.m.? These are all based on sort of models that are based on the ED's own, emergency department's own flow. Now, clinical prediction, if I go back again one slide here. So we talked about operational forecasting. I want to turn to clinical prediction because often misunderstood, and I'll tell you what our customers are telling us they want to hear, and then what we're doing. First, clinical prediction is not clinical diagnosis. It's around probability. It's around going from a journey from data to information, information to knowledge, knowledge to insights. So let me give you a real example that I hope will give you succinctly what actionable insights in a clinical realm means, and then what we are working towards, because this is what we heard from our customers, that they want this. So to give you the metaphor to sort of drive this clinical prediction home so we can all be from the same sheet of music, if I gave you a single blood sugar value of 144 milligrams per deciliter, you might say, well, okay, that's not normal. Did the person just have ice cream? Did they have pizza? Is it, fasting blood sugar? What is it? It's a single data point. It's valuable, but it's incomplete, if you will. Now, if I gave you a trend of blood sugars that was going up over time, that's information. You have, and this is what often most people talk about data visualization. is they're saying, look, don't give me data, give me visualization. They're saying, give me information. And there is more to be gleaned and learned if I gave you trends. And if I then said, okay, this patient has uncontrolled diabetes, I have begun to transition from data to information to knowledge. And what really is the question that is at the heart of improving quality and reducing cost of care and improving human experience is, so what's the chance this patient's going to have heart failure in the next 18 months? So data, information, knowledge, and insights. This goes back to that example I gave for the umbrella icon and the sunshine icon. All the data of Vancouver's weather on your iPhone in the morning is of limited, potentially of no value to you. You cannot sift through it all and arrive at an intelligent decision. You'll be better off just looking at the sky because you're using your neural network in your brain. So what you want is an icon. Do I take an umbrella or not? And what clinicians constantly tell us is it's not just about reams of data. It's not even about data visualization anymore. Remember what I said that chief operating officer asked me for prediction. Clinical prediction is this idea of moving up this value chain so we deliver insights. And what we are hearing, if you look at Philips's portfolio, we have solutions and propositions, whether it's in healthy living, whether it's in preventative, whether it's in diagnostic and precision health, and precision medicine and treatments, or in home care. Our customers are telling us, don't just give me data. Heck, don't just even give me visualization. Help me glean knowledge and help me predict with a probability. Patient flow was one example in an operational sense of predicting. And so these, by the way, we do this from everything from toothbrushes and nudging people for healthy behavior all the way to using sensors and nudging for different things, which I'll talk to when I talk about the last category. So what we are really exploring, and this is where if there's an opportunity for us to collaborate, we should. We are pushing all our solutions to not just give visualization, but to give insights, to give actionable insights so that clinicians can act on those insights, whether it's a nurse, physician, from pharmacist, a pharmacologist, you name it, technologist can work on. So that is this area when we talk about actionable insights and what our customers are asking us to do. This is what we are leaning in, whether we, some example I gave you, and other areas that are across the continuum care. I'm not going to talk about supply chain. It's an area that's very interesting, but we can't cover everything today, so I'll skip that. So let's turn attention to the last part of the story today. And then we'll turn to questions. So remote patient engagement, I sort of jokingly said, well, we won't talk about video visits. We talked about telehealth with the ICU thing. I don't want to double click on that too much. But as I said, when it came to vaccinations, we sort of as a global society, by and large, certainly in many countries, were forced on to adopt both delivering and adopting online scheduling. And at Philips, we have a number of solutions that are focused on patient management solutions that help with the schedule. Now, in the case of, since I use it as an example, vaccine, it's sort of one-dimensional. You make an appointment, you go have your vaccination done, which is really important. In the case of when you think of clinical care, or whether it's, for example, imaging, like scheduling a radiology exam, there are greater opportunities than just finding a slot in a calendar, because at that point, you've connected with a patient to actually do an engagement. Now, in this case, the premise is the schedule is the underlying premise, but there's so much more once you have that umbilical cord around finding a schedule. Now, clearly, there are things such as helping send reminders, which are both great for the patient because they may forget, but also great for the organization. One of the things that is always a challenge is that when you have no-shows, you're losing capacity. And in some communities, having a patient, now it shows not only unfortunate because the patient didn't get their exam or their appointment, but somebody else could have been in that slot. And so this idea of losing capacity because of suboptimal scheduling mechanisms and methods is one that is addressed. And one of the studies we did, we showed that having this tool for radiology reduced no-shows by 45%. And then equally important is care care continuity and ensuring that patients are on their care journey. So there's another study we did where when a specialist, when a generalist referred for a specialist, this idea of the handoff and the connection to ensure this actually happens is an important part of the care journey. And so this preventing a referral to drop into a chasm is an important aspect of this connection around scheduling. And so there's another study we did where there's a 30% improvement in actually this continuation from one handoff of care point to another point of care, because this method actually allowed for that to continue. And then one of my personal favorites is that actually to do with kids. We have also solutions that help, again, in this model of making an appointment for a child to have an MRI exam, we actually have tools that in prep, again, remember I said, once you create the umbilical cord under the auspice of making an appointment, there's so much more you can do. And in this case, it's an actual tool that helps children understand the imaging that they're going in for, in this case, MRI. And it's a 3-stage activity, which is why it's one of my favorites. So A, remotely engaging the parent for scheduling, but B, engaging the child for helping them understand what's actually going to happen in the MRI scanner. B, when they come in, there's a toy scanner called the kitty scanner. And the child, the same character, Ollie, is in sort of a stuffed animal. And then the child actually can practice scanning this character in the toy scanner. And then when they actually go in the MRI scanner, Ollie is the voice that actually talks to the child to breathe and not breathe and stay still. And Ollie's projected on the MRI scanner as they're lying down, the same elephant, and that character that was with the child from home follows them all the way through. And the so what is unbelievable. So 70% fewer rescans because the child can stay still better because they're more relaxed. 91% decrease in the need for anesthesia in children ages 4 to 6. This is mind-blowing. And 84% just doing a survey on the feeling of calmness as they went in for the procedure. So when we talk about remote patient engagement, there's so much more than just an appointment. The last thing I'll talk about, and then I'll pause for questions and discussion, is around connecting remotely through biosensors and wearables. And of course, in the case of, it's interesting, we typically think of sensors and wearables for being at home, which of course is appropriate. It's interesting, during the pandemic, there's a phase of time in which wearables were being used actually in the hospital because there was so much uncertainty, and healthcare providers were trying to avoid actually going into the room as much as possible. So we actually had an area of time where we got a lot of use of a lot of sensors and wearable technology that was actually being used within the facilities themselves. But one of the examples I can give you is from Phoenix, Arizona, an organization using wearables and the effect in this particular program, which was called intensive ambulatory care. So this is discharge to the home early, but with wearable technology in order to monitor the patient. You know, some call it hospital home. It's probably a little bit overused term. I prefer what this organization called intensive ambulatory care, IAC, or ambulatory intensive care, AIC. Trying to remember which one. But this was basically around putting sensors, wearables, and then helping remotely monitor the patient in order to early discharge, but also having high acuity of care at home. And they followed patients for 1 year. And there were, there was a, I'm trying to remember what the rate of, there was this, that's 50%, a 50% reduction in readmissions in the patient, the same patient population. That's right, the same patient population, they stayed in a year before they went on the program and for the year after they were on the program. And in that, when they compared the same, so internal matched, the same patients a year before, a year after, there's a 50% reduction of readmission to hospital based on this using sensors and remotely managing patients in an intensive ambulatory home setting. And these are, of course, monitors from Philips, as well as there's software from Philips that helps do this. And Banner Health, which is the one of Phoenix, is one of the sites in which we've partnered together and done some co-creation of some of these programs. Okay, so I've covered for you the things we're hearing, the signals we're getting. Help us remotely access clinicians, help us get actionable insights, help us connect with patients. I hope these have been useful for you. I look forward to any questions you might have. And Darren, I'm going to pass it back to you. Thanks so much for giving me 25 minutes to present to you, and I look forward to have a conversation.
Yeah, I think that's great, Shez, and thank you for the presentation. I hope that everybody on the line was able to get a sense of how we at Philips are innovating in this space. And before we jump into Q&A, I'd like to provide a few, sort of bring to life a few examples across Canada where we're partnering with our customers, certainly in the virtual and digital health space. And you know, Shez talked early in the presentation about increased level of interest in virtual and digital health, and we're helping to bring this to life. So I'll provide three quick examples, some simple, some complex, but certainly all we believe and our customers believe really impactful for healthcare delivery. So let me start on the West Coast. In Western Canada, we're working with several clinics that have really struggled with data silos and ultimately information sharing across a large geographical footprint. And so in this case, Philips is partnering to integrate these clinics to enable their staff to collaborate as one network. And we're leveraging for our partner a single cloud-based ECG management platform. And sounds relatively simple, but it's really, really impactful. And we hope to improve the quality of care they deliver, obviously the right data at the right time to provide quicker care, and then obviously impact health outcomes too. So we're proud of that opportunity, and that partnership's in flight right now. If I move a little more centrally to Ontario, we're working with researchers at Hamilton Health Sciences and McMaster University in developing a potential solution to bridge the gap between hospital and home for patients who undergo major surgery. And so SmartView, and some folks may have heard of SmartView, is a remote automated monitoring and virtual hospital to home care system that follows patients who undergo cardiac and major vascular surgery. And the solution utilizes Philips' unique technology and includes a team of nurses to wirelessly monitor a patient's vital signs on the unit, and when released, continues that monitoring at home during the first 30 days of recovery. And so using mobile technology, nurses can follow patients through the recovery process, ensuring any complications are identified and triaged quickly. The solution is currently being tested in a formal research trial to determine whether it can reduce hospital readmissions, complications, and ultimately death that can occur in some cases in the weeks following surgery. So a little more complex, a little more integrated, and certainly working with a reputable institution in Hamilton Health Sciences and McMaster University. And so I'll shift east, and actually Shez talked about over-the-shoulder ultrasound. And this example is from Quebec, where we're working with our customers on a solution to expand access for maternal fetal imaging in rural and remote settings. So in this specific region, healthcare is provided by 4 hospitals covering through 3 counties, and where physicians are shared and support is limited, especially in the most remote site. So expert physicians at the University Hospital are connected virtually with an ultrasound device and sonographer in a rural town to a secure interactive audio-video platform called Collaboration Live. And so Shez talked about this as over the shoulder and support to remote locations. And this is a technology actually we acquired during the pandemic from a Montreal-based company. And so ultimately it allows sonographers working at remote sites to interact with specialists at the academic site to show live scans and receive real-time feedback on their findings to take action. So we're really excited about this one in terms of combining ultrasound with telehealth to make imaging accessible almost virtually anywhere, I should say. And it's a really amazing yet simple and innovative solution to improve access to care. And from our perspective and our partners' perspective, we're targeting a reduction in time for first-time right diagnosis, And then the big one is decreasing patient travel to and from large urban centers. So being able to provide faster quality care closer to where patients reside. And then as a secondary outcome and focus, it also provides enhanced education and training for rural sonographers. So in true partnership fashion, Philips will also be partnering with the institution to gather the data around the effectiveness and outcomes. And when successful, we will expand and deploy on a larger scale to help all remote communities in the region. And we're really proud at Philips and Philips Canada to be able to engage with customers at this level, and in this specific case, remove geographic barriers to healthcare delivery. So I wanted to share some of the amazing work with all of you today. I hope it's inspired you by some of these real life examples and innovations in virtual care. And so before I jump into Q&A, I want to share with the group that, Philips, we continue to invest in our out-of-hospital virtual care solutions. Many acquisitions over the last few years. I spoke about the one from a Montreal-based company, as well as numerous initiatives in research and design and development. And so we are open as an organization to partner with you. And if there's interest level based on the content that was shared or otherwise, certainly please reach out to me. I'll be happy to explore that with my team. So with that, we'll jump into Q&A, and I'll just take a quick peek across at the screen in terms of questions. Bear with me for 1 second. So Shez, maybe if you can kick us off. So the question is, you joined Philips from AWS, and the question was, how do you see your experience at AWS as a leading cloud provider shaping innovations here at Philips?
When I look at what Philips is doing, and by the way, I came here because Darren, you mentioned one of our missions to improve the lives of 2.5 billion people every year, of which 400 million should be underserved, is actually one of the main reasons I joined. I really wanted to be close to that mission. And from a cloud perspective, there are a couple of things. So Philips, about 5 years ago, decided that it will move its offerings to the cloud, which was at the time, if you think back 5 years, it was not necessarily a foregone conclusion. And so what Philips has done is sort of take what everybody else gets as a cloud, and on top of that built a medical grade cloud. So we took the conventional cloud that's offered and put a platform, we built a platform on top of that, which we call Health Suite. And that is essentially medical grade compliance, geographic compliance, Canada, US, UK, Europe, you name it, added the compliance tier, the security tier, the manager, what really people in that industry call the control plane. And then we are now building, we have been for the past 5 years, moving all our offerings onto Health Suite. So cloud is down below. That's where I was. I was at AWS. I was sort of the undifferentiated cloud at the bottom of the stack. We built at Philips Health Suite, which is the medical grade stack on top of the cloud, and then building our solutions on top of that. And that allows a few things to happen, which are really exciting. And just very briefly, one, it means that our solutions can start to talk to one another. And from the perspective of our customers, said, look, if I buy 2 Philips stuff, I want them to be able to be integrated. And so we are, as more of our solutions move on to Health Suite, by definition, they're interconnected. And then Health Suite itself uses standard industry interfaces, a FHIR, DICOM, HL7. So when Health Suite comes into an organization, it plugs into the fabric of the organization using standards. So a great example is UCLA, for example. UCLA in California said, look, we're going to drop in Health Suite. We got a bunch of Philips stuff, and we're going to use Health Suite to connect to the remaining fabric of UCLA. Now, everything in UCLA all connects through this Health Suite fabric. So not only Philips stuff, but also UCLA and their building stuff too. From an AWS story coming here, what's exciting is that this is specific to healthcare. When I was at AWS, the story was a little bit more generic, right? I mean, things like, by the way, Amazon was a great company. I had a terrific time there. I learned a lot. And the story here at Philips is it's specific for healthcare. So it's built on the public cloud, specific for healthcare. So that's this distinction, if you will, between where I was and where I am now.
Good, thank you, thank you. Actually, quite a few questions. I don't know if we'll get through them all, but we'll do our best for sure. So next question, my interactions with Philips have typically been transactional. I'm not familiar with how partnerships with Philips look like. Can you please provide a few details? So maybe Shez, I'll take this one and give a Canadian
Yeah, sure.
hit on this. So what I would share with the group is, in contrast to traditional transactional relationships, for us, forming strategic partnerships is identifying a shared vision with our customer and shared benefits to both organizations. So I'm sure everybody on the line knows that if there's not mutual benefits to both organizations, it won't pick up the traction. And so certainly first the shared vision, and then shared benefits. Our engagements closely tied to our customers achieving their goals and ultimately tied to the quadruple aim. So at a high level, we start with a defined problem that our customers are trying to solve. So you could talk about an example like Shez talked about today around operational forecasting. Just as an example, we'd work closely with our customer to define root causes of the problem, and then bring in our experts paired with our customer experts in a co-creation fashion. And we have a standardized way of doing this to really be able to tease out the expertise on both sides, our organization and then certainly the customer organization. Deep expertise locally in Canada, as well as back to our respective businesses and experts that we would bring in to interface experts on the customer side. And really for us, defining what the solution and framing that out, developing key performance indicators, performance-based metrics, and then establishing governance in terms of a roadmap of how we'll get to that, North Star as a group. So examples can be as large as a relationship with like Mackenzie Health as their managed technology services provider, or as simple and innovative some of the examples that have already been shared on the call today. There's certainly no one size from my perspective and my team's perspective, one size fits all solution. It's characterized by that specific hospital, by that specific Ontario Health team as an example. So this is the importance of co-creation, showing tremendous value, and then also the governance. So hope that provides some insight to the question. And then I'll just quickly bring up the question, Shez. I think I saw another one for you, and we talk about barriers to healthcare. We've talked a lot about virtual, over the shoulder. There's a specific question about internet connectivity, so let me quickly play it. Have you given consideration as to how these innovations would work in northern and rural remote communities that have specific barriers such as lower internet connectivity? Happy to also chime in on that one too, but maybe throw it over to you.
I'm going to give a shout out to the team in Montreal that built Reacts because so yes, this is an area that's really keen for us in terms of being able to make we talk internally at Philips about accessible, affordable, sustainable innovation. Every time I say the word innovation internally in our own memos, those three words come in front of it: accessible, affordable, sustainable innovation. It's not just about innovation, because you can make innovation that does not impact the lives of 2.5 billion people globally, and 400 million of which should be underserved. So with that mission, we are forcing ourselves every single day to look at sustainability, look at accessibility, look at affordability. Those three vectors are used in accessibility. So for example, the team in Montreal and the React solution that we purchased from Montreal, I shared with you just during my brief presentation that it's being used in Rwanda. I'm not trying to say Rwanda has no internet, but it's certainly not fiber optic to the desktop like it is in whatever. So absolutely is an area of keen interest. We keep a very close eye. At Philips, we even think about if the AI algorithms we're using is using too much electricity and is not healthy for the planet. We spend time calculating the energy use on the AI algorithms and how can we build algorithms that use the least amount of power. So we obsess over these things, absolutely.
I think that's great. And I see Matt back on. There are about 5 or 6 other questions. Folks, feel free to reach out to me direct and I can answer them, but I'll respect the time. And thank you so much for the opportunity to be here today. Appreciate it.
Thank you.
Darren, Shez, thank you very much. Fantastic conversation. As everybody knows, we do pride ourselves on finishing on time, and we've managed to do that today. As Darren mentioned, there are a few questions that we did not get an opportunity to address. I will take those questions, forward them off to Darren and Shez, and there may be opportunities via social media or whatever else for them to ask these questions or answer these questions. With that, thank you very much. Have a wonderful day, and we'll talk to everybody soon. Bye-bye.
Thanks so much. Thanks, Matt. Thanks, Jared.